Feeling constantly tired? Struggling with your mood or drive? You're not alone. But getting help in Australia isn't simple. The public system has a rule so strict, it blocks most men who are suffering. Your first thought might be your local GP, but this route often means long waits and frustrating setbacks. But there is another, more direct route that thousands of Australian men are now using. Next, we'll show you the two worlds of TRT in Australia, who it's for, where to get it, and the real costs and risks. Let's start here. TRT is a medical treatment for a condition called hypogonadism. It's a regulated therapy, not a gym supplement. Physical symptoms can include loss of muscle, increased body fat, constant fatigue, and reduced sex drive. Mental symptoms can feel like brain fog, a lack of motivation, severe mood swings, or even depression. While symptoms point the way, the only method for a true diagnosis is through detailed blood work. The decision is based on data. If diagnosed, Australia's Therapeutic Goods Administration has approved 3 main forms of treatment: gels, patches, and injections, so you have the symptoms and know the options. Now, how do you get it in Australia? This is where the system splits in two. Let's look at Path A, the public system via a GP and the pharmaceutical benefits scheme. Why is this government-subsidized route so difficult? The reason is this number, 6. Your testosterone must be below 6 nmol/L on 2 separate tests to qualify for a PBS subsidy. Why is the bar so high? It's about government cost control and reserving treatment for only the most severe clinical cases. This brings us to Path B, private TRT clinics. They operate outside of the strict PBS restrictions, allowing them to treat more patients. Private doctors look at the bigger picture, your full hormone panel, and specific symptoms. They treat the patient, not just a single number. So you have a choice: the strict, slow, subsidized public route, or the faster, flexible, but self-funded private one. What results can you expect? The most reported benefits are a return of energy and vitality. This often means improved libido, sexual function, and better quality sleep. TRT can significantly improve body composition by helping decrease body fat and increase lean muscle mass when combined with exercise. Many men report a real improvement in mood, focus, and motivation, lifting the brain fog of a low testosterone. A vital long-term benefit is increased bone mineral density. This helps protect against osteoporosis and fractures as you get older. These results sound great, and for many they are, but TRT is a serious medical treatment. You must understand the other side, the risks. Let's be clear about side effects. Some are common and often manageable, like acne, oily skin, or some fluid retention. But there are significant risks that require careful monitoring. TRT can increase red blood cell count, raising the risk of clotting if unmanaged. Vitally, TRT shuts down your body's own hormone production. This stops sperm production, causing infertility. It is not for men planning a family. These serious risks are a primary reason why the public PBS system is so restrictive. Their goal is to prevent widespread complications. Finally, for some men, TRT is not an option at all. This includes those with a history of prostate cancer or severe sleep apnea. So let's connect these ideas. The choice between public and private is about your approach to these risks. Private clinics offer closer monitoring. Of course, this personalized management has a cost. Private TRT in Australia typically ranges from $100 to $200 per month. Remember the initial frustration with the GP process? The private cost is the trade-off. You're paying for speed and a plan for you. You now understand the routes, benefits, risks, and costs. But before deciding, know that TRT isn't the only option on the table. For some men with borderline levels, lifestyle changes can make a real difference. Consistent exercise, better diet, and improved sleep are foundational. There are also other medications that can stimulate your body's own testosterone production, but they have their own side effects. TRT in Australia is regulated and accessible if you know which system to use, the strict public system or the flexible private one. It is a medical process. Your first step is not to guess. It's to get data. Speak with a doctor, get detailed blood tests, and have an honest talk about your goals and options.